today we're going to go over what we call in our office a definitive therapy appointment, or sometimes other offices call it a reevaluation appointment. So this is an appointment that you get about 4 to 6 weeks after you've gone through scaling and root planing or root debridement therapy because you had periodontal disease. So you come back in and this is the type of cleaning that we'll do for you at that point.
So what happens typically during this appointment is we'll do a reevaluation of the tissue, reprobe, go around, see how good your home care is. Did we get good healing? So it's a lot of comparison from what we get at this appointment versus what we got when we first determined that you have periodontal disease and did the RDT or SRP cleanings. And so again, a lot of comparing, a lot of education, just seeing how did this work? Do we need to do something else? Do we need to refer to an oral surgeon, periodontist, anything like that?
So we will go around again with the Cavitron and disrupt any biofilm bacteria. Sometimes people have a little bit of new buildup, so we'll clean that off. And then we will also polish and floss. Occasionally, if there is a few areas that didn't respond in the way that we like them to, or if there is still a little bleeding, we will typically use laser therapy in those areas too, just to kill more bacteria and try to give the tissue the best chance that it has. And then we determine the recare appointment.
So at the recare, how we determine that is based off of how much healing you had, how well controlled is your periodontal disease at this point. A lot of people still have a little bit of healing after that 4 to 6 week time period, so we don't freak out if there's something that didn't heal quite as much. It's just an opportunity to then be like, okay, let's try something different, let's do some more laser therapy and all that kind of stuff, and see you back in either 10 weeks, 3 months, 4 months, depending on what we see at the evaluation appointment. And then from there, at the next time we say, okay, do we need to try something different? So it's a lot of figuring out how do we best maintain the oral health that you do now have, and keeping the periodontal disease stable and not letting it progress further. And it's not going to be the same for each person.
Right. And pretty much across the board, if you've had periodontal disease, you'll probably never go back to a 6-month type of cleaning. I have almost no people that have good enough home care and good enough oral health to ever go back to a 6-month. It's typically 3 to 4 weeks because, not 3 to 4 weeks, 3 or 4 months, and every now and then that 10 weeks too, depending, just so that we can get in there and disrupt the bacteria and stuff. That's usually, studies show that's the amount of time that it takes for that bacteria to start accumulating more than you can handle at home. So we don't ever really go back to the 6-month. So that's what we do at a definitive therapy appointment.
Yeah, and sometimes it's a little confusing for people. I just want to say this, that they're like, well, why can't I go back to 6 months? Yeah. And it's like, you just have to remember that at a 6-month cleaning that we call a prophy, again, that's only above the gum line, at your therapy appointments of maintaining this periodontal disease, we are going down beneath the gum line and getting all the bacteria that you can't reach, even if you have spectacular home care. So it's just, you just need a little bit more to help stay healthy.
Yes. Let us know if you have any questions. Hope you guys are having a good day.